Hello, good evening. How are you? Welcome to another session of Ask the Doctors. This program, we dey call them Ask the Doctors every Sunday by 8 p.m. Nigerian time. My name is Dr. Frederick Unobohai. People call me Dr. Fredostar. And I always tell you good life. Good life in a sense. Now, this program holds every Sunday. For the past 4 to 5 years now, we don't dey do them every Sunday. I be the host of the program, and my co-host now Dr. Israel. Dr. Israel will soon join us on the program. Today, we dey do question and answer. Meaning, say if you get any question for me, drop them here. We go answer you. But remember, we not they share medicine on the internet. We know they make diagnosis. This place no be hospital. This place no be clinic. We are not having a consultation. So we can't prescribe any medicine for you, though we go advise you. If you get any medical condition, you dey sick, go hospital. Or you go book for private consultation. And we know the private chat anybody. We know they give number. Here, we just the answer everybody. So if you get questions, ask me right now and I go answer you. But remember, we know the private chat. I know the private chat anybody. I know they give my number to anybody. If you ask me here and I know the answer, by the grace of God, I go answer you. So how are you and where are you watching me from? Now, I did live on Facebook and I did live as well on my YouTube channel. So anywhere you did watch me from, whether you did for Nigeria, you did Ghana, you did South Africa, you did England, you did the United States, you did Cameroon, China, Australia. Anywhere you did, you're welcome. Now, Dr. Israel is in the house. Dr. Israel, they here, and I'm gonna bring up Dr. Israel very soon so that we could take all your questions. Yes, Dr. Israel, if you did ready, just give me just give me thumbs up and I go bring you up. Yeah, man. If you're ready, just give me thumbs up and I'm gonna bring you up. Okay. Yeah, yeah. Dr. Israel, how you day?
I'm fine. Happy Sunday. Good evening
Yeah.
to everybody.
Yes, good evening. I hope maybe the people for TikTok feed they hear you, maybe because it's gonna be hard, but let's see. Now, more we go straight to the questions. We go day fast because we get a lot of questions. But before we continue, I beg share this live session. Somebody's asking a question. Henry Igwe, he says coughing out hair. So whenever he cough, in the cough out hair. Hair, what is the cause? Okay, you go
I don't
answer them.
understand which kind air. Which kind
I
air
really
be
don't.
that? Which of the air?
I swear, I wish I understand what he mean by it. They cough out hair because you no supposed to dey cover out hair. So please, Mr. Henry, throw more light. Explain and beg so that we go fit answer you. Huh?
If they cough,
Onyeka.
if it is in an air, they cough out, may go hospital. That will not be
Uh-huh.
waiting that the answer for social media.
Oh, you don't hear. If na hair wey dey your head, now you dey cough out. Abeg go hospital. No be waiting that they answer for social media. Hmm? Yeah, yeah. For those who they watch me on TikTok, and if you get questions for me, you go have to come to YouTube or Facebook. That is the only way we can take your questions. Onyeka says, please, can one take folic acid during monthly period?
Yes, you can take. You can take folic acid during monthly period. You can even take other multivites during monthly period. There's no problem with that.
Okay. You don't hear. Now make I add something to that, which Dr. Israel talk. Most women believe, say, when they on their period, may then stop whatever medication. My dear, as long as you have a reason, you have a reason for taking your folic acid, go ahead. Nobody talk say you go stop. Okay, if you get question for us, ask us this night. Now question and answer session. You understand? Let's take another question here from Nero. Nero says an asthma result says likelihood and asthma. What does it mean exactly? Wait, I beg, make I ask Nero. When you say asthma results, who give you that result? Who gave you that result? Because I don't want us to comment on results where some people just go fabricate from anywhere. So tell us exactly where you got that result from. Who give them to you? You get why I need to add this there. What are the
And
necessary?
and and another thing, who send them for the test before you can get that result?
uh who sent you for the test and who gave you that result? Two questions, because we need to go down to the root of your question. Okay, we get question from Steven. Steven on Facebook. Steven says, what are the necessary treatment for someone coughing out blood with sputum?
Okay, the necessary treatment for that person, I may go hospital. When you get to the hospital, you go meet doctor. Then doctor go um, ask questions. They want know for how long you don dey cough. Um, when you come start to dey see the blood, e start from the beginning or na later? Wetin be the quantity of the blood? How many the blood is? Is it very many or na just small stain? If you dey
Yeah.
cough, wetin dey happen? You dey get chest pain? You dey breathe well? All those are many questions wey dem go ask, wey dem go fit know, and some others when I no ask, when I fit know when wetin dey really do you. So with that, you'll be able to know what and what to do for you. So I go advise you go hospital, see a doctor, so that make dem examine you, send you go do test, the investigation wey dey important to you and relevant, and they go now tell you the kind of treatment wey they go give you.
Yeah, thank you. Thank you so much, Dr. Israel. Now, there's you get one thing where make I add a beg. Our people, a lot of our people go buy themselves on the internet. See this person, they ask us, person they cough out blood and sputum. You are not supposed to be asking for treatment. You understand? That is not what you should be asking for. Waiting, you supposed to they ask, where you supposed to they ask your doctor. Now, make them find out why you they cough out blood. I'm saying this because you go jam people on the internet, they go chop you, chop your money, scatter your body, they go run leave you. If you they cough out blood, you should not be asking for treatment because nobody know. Now hospital they go find out waiting they make you they cough out blood. When they don't know waiting they cause them, like waiting Dr. Israel talk, then they will come give you treatment. Not they look for treatment like that. What causes water to come out from the left nostrils?
Every time you get catarrh now, when you get catarrh, when you get catarrh, most of the time, sometimes catarrh might be thick, the mucus might be
Yeah.
thick, and it might be watery. Maybe that would be
Mm-hmm.
the reason why you're having that in your left nose. Except maybe you drink
Yeah.
water, you weren't you drink am in the way where you're not supposed to drink am. So sometimes when you can't
Yeah.
choke, the water fit come out for your nose just in that manner. So those are some
Yeah.
instances when you fit get water like that. Say you just stay, water just dey come out for your nose. E no dey happen that way, except na blood epistaxis. So if na blood, we fit tell you say okay, you do this, or you go hospital. Most of the thing na you go hospital and they will find out what is really happening. But if na water, e mean say maybe you get catarrh, and also you need to also go hospital for follow up.
Okay. For those where they watch me on this platform here, I don't want to mention them because of the. For those where they watch me here now, and you won't ask me question, come to Facebook or YouTube. Hmm? Go to YouTube, type Dr. Fredostar, or go to Facebook, type Dr. Fredostar Official. So you where they watch me for here, I don't want to call the platform here, and you won't ask questions. Quickly go to YouTube or Facebook, type Dr. Fredostar Official on Facebook or Dr. Fredostar. Okay, Dr. Israel, we get question here. It says, I beg, if man no they get morning standing, I don't want call him because of this social media stuff. At least the man block us. You know they stand in the morning. A sign of problem.
Okay, in some cases, na sign of problem. Some in other cases can just be sign of
Okay.
stress and tiredness of your previous day work and where you still sleep that night. So if e come dey too much, say e no dey happen, and when you try to go the other room, e no still dey happen, no dey get up as e suppose get up. So then you know say problem dey. In that case, you need to see doctors wey dey specialize in that aspect of the man body, so that make dem for fit tell you what and what to do, and make dem for fit treat you. But if you know say you be person wey dey consume a lot of alcohol, try stop am, because that one fit just be the reason why you dey get why that kind thing dey happen to you. Yeah. Dr. Fred.
Yep. You don't hear the answer from Doctor. Yes. I dey hear you. Thank you. Okay. If you dey watch me, you dey hear me and Dr. Israel. I beg share this live session. Share because as you dey ask us questions, we will dey try answer you. You self, you need to share. Okay. Please, what causes hernia in an infant? That is baby. Wetin make pikin dey get hernia? Okay.
Okay, hernia for infant most of the time na let me just say congenital issue. Is it congenital now? Yeah, let me just say congenital issue, because for male boys mostly, e get, because those balls, the balls for men, no be there wey e dey, no be there be normal, no be there e stay from the beginning. Most of it na
Yes.
belle, inside belle na that thing from form. So e go come pass through somewhere, come go enter that where e dey stay now. But in some cases, that line wey e take pass come go where e dey now, for some people, some children, that place go still dey open. And normally, as they grow, that place suppose cover one kind, so that nothing go fit pass through that place. But because e no cover, e dey open, other structures fit go enter. Na im dey cause hernia for young children, na im dey cause hernia for children. And also for some children, the navel wey go big well well, na still hernia be that, because the navel the space between there not really close as e suppose close. So e go come cause hernia for the children. So that na the reason why some children dey get hernia. And not be say because they don old, because of some part of the body wey suppose close during development, and even after they don born finish, but those place not close. So intestine, small intestine mostly will come fall inside that place, come dey come out as hernia.
Okay, let's take the next one. So Nero says the doctor from General Hospital now recommend you should go for it. And the doctor recommended the place for you, which I don't think is right to mention names. Okay. So Dr. Israel, he talk say now doctor for General Hospital, nine tell him make
Okay,
you go
as
do
far as
asthma
doctor
test.
now recommend am for you, go back, go meet the doctor, make e explain to you, because una don start discussion before e come send you the test. So e get your file, e get your folder, e get everything about you. So when you go ask am the question again, e go dey able to answer you. E go dey able to answer you. So that's why I go advise, and make you go back, go meet the doctor again, make e explain all those things for you wey you see for the scan.
Okay. Let's see. Which other question we get for here? Oh my god. Please. My grandma, 83 years, have been experiencing discharge from her birth canal. She visited hospital some weeks ago and she's still having same experience. Mr. Steven, I beg, I want to ask you a question so that you go respond to us quickly. When your grandma go hospital, wetin dem do for her? Wetin dem test her? Wetin dem say be the problem? Because your grandma is 83 years and this discharge, I believe say they go check am, tell am many, many things. So what did they do for your grandma? You understand? If you talk, say she still dey get the experience, wetin dem do for her? Hmm? What causes every 1 hour to urinate? You dey urinate every 1 hour.
That one shock me. Be like say you just put time near yourself to calculate how many how many hours you take dey go urinate. However, if you dey take water very much, you go dey urinate often. So if you dey drink water well well, e go make you dey urinate often. That one dey good because it shows say your kidney dey work well. If the weather
Mm-hmm.
is very cold or you dey stay where dey very cold, you likely to also dey urinate often. There are some medication when if you take, go fit still dey cause you to dey urinate often. Then
Mm-hmm.
if person get sugar for e body, e go still dey go dey urinate often. Then another thing na for men, if they don dey old small and they don dey get problem with that urine tract and prostate, they don dey get problem with those place, they fit go dey urinate often. And in that case, sometimes they no dey even urinate the urine when they wan urinate, they no dey urinate am finish. And sometimes they go dey rush, dey quick go piss and all that and all that. So these are some of the few things when fit make person go dey urinate often. These are the few things. So you think which of them you think say you fall into? But if the thing still dey disturb you very well, you can actually visit your doctor so that you need to see a urologist or a neurosurgeon, yes, urologist, so that e go fit follow you up and see if there are other reasons wey go make you to dey urinate every 1 hour. And also, sorry, the last thing when I think say fit cause am na still infection. Somebody wey get infection of maybe the bladder, the urethra, go fit that one go fit still cause am because any small urine go irritate the bladder and the urethra and you go wan pass am comot. But the only difference is that pain go fit follow that one and other things. Okay, over to you, Dr. Fred.
Okay, and now make I read Nero. Nero, I don't know if you still there here. I see your other comments. I go read them, but I no go pin them for the screen. It says you went for spirometry. The report says likelihood of asthma. Okay. And you've done a spirometry. Your doctor said me you go do spirometry. Likelihood of asthma. We don't really know why he sent you. Maybe they get difficulty with breathing. Likelihood of asthma on this platform, waiting the result they talk, it means say maybe you get asthma, but we cannot give you that diagnosis. But waiting your report they talk likelihood, meaning say maybe him asthma. But the person we go confirm now based on everything we know about you and your results, now your doctor. But within that result, they tell you right now in your hand, likelihood of asthma, meaning say maybe you get asthma. Full stop. But your doctor then go really, really confirm for you. Okay. Somebody says, please advise me. I have breast lump and biopsy says it is fat necrosis. Then on the spot. Then on the spot, I have infection. I'm taking amoxicillin given by your doctor. And he says he wants to remove the whole lump, but I don't want surgery. Is there any way I can treat it without surgery? Okay.
Okay, you get breast lump, you did a scan, and your doctor is advising that you should remove it, I think it's based on how big the thing is. Now make the doctor they say make you remove am, because no doctor except, well, there's no doctors that when I know, or there's no doctor when they follow a book, or they follow wetin the teacher, or they follow the right uh, information, go say lump wey no big, go say make you remove am. um So, and also that na one thing. So it depends on how big the lumps is and how disturbing it is to you. So if the lumps is very big and you think it's disturbing you, I think you should follow your doctor's advice. You know the funny thing, I no dey see the lumps, I no even know how e be, but based on your description and for your doctor to have said it would be nice for you to remove it, I think you should. That's if it's big and is discomforting. And there are some lumps that also go with pain. Also, if you have all those kind of disturbance, discomforting ish symptoms, please, it will be nice you remove it. And sometimes if something don't too stay for person body, if it go cause another thing. So think that one as well. Are you ready to wait for any other complications when if you follow that breast lump? And also with the site where the breast lump go dey, are you ready to wait to follow
Mhm.
to get the consequences or the complications? If you think you are not ready for those kind of things, I think it will also be nice to remove it. It will also be nice to remove it. But if you think say no, 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 wetin that your doctor you not like am, you can also go and see other doctors, general surgeon. Um, yes, you can actually go and see other doctors to see
Okay,
or not.
Doctor.
And
Oh,
by there, you know, say you dey hear me now?
yeah, go ahead. Go ahead.
Okay, there you know, say you don't get two opinion and you follow the best one.
Yeah, and if I may add as well, in addition to everything we Dr. Israel don't talk, now still your body. If you talk, say you no one do surgery at all, despite the fact say they don't advise you, everybody advise you, nobody go still force you. Now still your body, now still your choice, because treatment is not force. You go decide as well. Say, okay, I won't do them. If you say you no one do them, the doctors not go force you. But what we go advise you here be say, no go good, make whatever your doctors don't see, make it no can go cause you another problem. Or may you go say you dey find something to rub on top, we go melt am, because now them see am and they know how it be. But at the same time, this decision you have to carry together um with your doctor. Yeah. Okay, let's see. We have a question here. It says, good evening. My question is, does hepatitis B um have get cure? I mean, to eliminate it all in the body system. Hmm.
Okay, normally we dey fit manage hepatitis B. So it is even better. It is even better that you don't even have it, and you take the vaccine. It is better that way. So, because once person don't get am, most of the time people fit talk say, the treat am e comot. But we don see cases where we say after they say the treat am e comot, after a long period time, you go check again, they go see am again.
Hmm.
So the only thing wey dey happen most of the time that e dey fit dey in a quiet state. You go there in a chronic way when be say e no go show itself. So person can live life long and e go look as if nothing dey do e liver. But
Hmm.
if you get hepatitis B, it's good to see a doctor. Make dem check am. If na something wey dey affect you at the moment, they may give you medications that can help you, and that can help you. So we will not want to say that it's curable, because there are so many there are so many studies about hepatitis, and most of them always think about prevention and then about prevention and otherwise. And most of them don't really want to talk much about the cure, because sometimes for some people, as I earlier said, they fit take some medication because they get medication for it. Take some medication. After some time, they'll do tests. They fit say e don comot, but years back, they might go back and do tests and they may notice it again. And this bring for us to know say today na world hepatitis B day. Today is what? Today is 28th now, shey? 28th July.
Yeah.
So it's World Hepatitis B Day. And the team now, it is time. It don't reach time to prevent, it don't reach time to end hepatitis B, and they need all of us support. And the only way we will fit to support ourselves now to know how it can be transmitted, and also take try test yourself, screen yourself for hepatitis B. If you are negative, go any of the health center, go any of the general hospital, go any of the center where they do immunization, whether private or government, and go and take hepatitis B vaccine so that you'll be protected from it. Why for those who don't already get and still go and see your doctor, a gastroenterologist to be precise. When you see her, you know the medication wey go give you that will protect you and your people around you as well. Thank you.
Thank you. If you just they come, you dey welcome. Tonight now question and answer. Any question where you get, try drop them. We go try respond, but we no go fit treat you here. We no go fit prescribe medicine for you here. Now advice we go advise you. If you never share this video, do well to share this live session so that more people go learn. Blessing says, I beg go. Anytime I day on my ovulation, headache they worry me. What could be the cause?
You don already talk am now. But anytime you dey
Mhm.
your ovulation, that's the time you're having the headache. So what do you think is the cause? Is the ovulation. So
The
the highest thing you
ovulation.
can do is to take something that will reduce the headache for you, or take a lot of water, fluid as well. And so no, there's no big deal. It's not a problem. Some people when they even dey on that state, some of them go dey feel like say that they sick. Some will get
Mm.
fever. Some of them say that belle go dey pain them, and some dey irritated, their mood change, and all those things. So there's nothing you can do about it. It's just a change. It's just a change of hormone system. So when hormone
Mhm.
change, so it always be like that. So if thank God, your own are just headache, take anything that can stop headache or take a lot of fluid, so you'll be fine.
Okay, you don't hear. The answer is clear in your question, especially if you notice, say, now when you day on your ovulation, now it they come. That is the answer, and the cause be that. You understand? Mm. Okay, let's see. Questions plenty. Oh God. Good evening. Please, can depression cause sharp pain in the chest? Make I answer quickly. Many things, many things we call sharp pain, plenty things. The reason why they start with plenty things, so that make we not talk yes, and then we miss other things. However, some people feel get physical symptoms, yet now mental health condition they cause them as well. You understand? But if we conclude, say now mental health condition they cause them like depression, it means say we don't check every other thing where they cause chest pain, because there are many things that can cause you chest pain, plenty. So we no go just leave all those ones, just go talk say na depression, unless they don't come out all those other ones, can say okay, maybe now mental health condition like depression, because some people figure mental health condition and they could get physical symptoms. Do you understand? Okay, Israel, want to add anything before we go to the next one?
And also, if you think say you get depression, you need to see a psychologist or a psychiatrist. May they evaluate you and give you the best treatment, because depression not be child's play, and it's not a one day thing. Yeah, there are different type of depression. For if a person think say now the depression they cause everything when they body, it means say that depression don't take for a body, don't
Mm.
take. So you need to actually see a psychiatrist or a psychologist, clinical psychologist, to address that issue. And as Dr. Fred talk, before you go even thought say na depression cause it, because yes, depression fit give you some physical symptoms. So before you fit talk say na depression dey actually cause all these symptoms, you must rule out other cause of that particular symptom, because there's many things dey wey fit cause chest pain. Chest trauma fit cause chest pain, TB fit cause chest pain, asthma fit cause chest pain, angina fit cause chest pain. You get issue with the heart, e fit cause chest pain. You get issue with your lungs, e fit cause chest pain. So many things fit cause that chest pain until you don rule those things out, and they come see say nothing dey wey dem fit say na im dey cause you the chest pain, before dem fit come talk say yes, maybe na this na depression or na any mental health issue wey the person get, na im dey cause the chest pain. So it's dicey to just say na depression cause chest pain.
Okay. If you never share this live session, why? Share the live session. Don't forget, if you want to join my private Telegram, you can subscribe. Look for the link on my page. Click on the link to subscribe. You are seeing me live now. I make I tell you, get why. Click on the link. You go use your card details to subscribe and join. If you find them difficult to subscribe, let me know what the problem is. Now, somebody talk say in grandmama go hospital, the grandmama they get discharged from the private. I can't ask him question. You say go hospital, but he's still there. You say urinalysis test was done, which showed bacterial infection. According to the doctor, she visited the hospital on the 14th of last month. Dr. Israel, you want to respond to this?
Okay, I don't know, but I don't really think it's urinalysis your mother do. Maybe urine MCS, maybe urine MCS, not really urinalysis. So if he's telling you it's bacterial infection, if it's urine MCS, it does, and the doctor saying a bacterial infection, treat the bacterial infection, and I think the discharge will stop. However, if the discharge not stop even after treatment, we also need to look at every other thing wey fit cause am. How often does she change her on this? They bleed. How often does she bathe? How e take dey wash? Forget say na old person say, no, I don tell you, no be me dey born now, no be me dey. How e take dey wash and all those things. Also, e get partner, because you never can rule that out as well. So if you get partner, say still dey, you understand, you also need to find out. So I know you say the age, that one don too old, nothing can. So when you don't find out all those many things, then your doctor will be able to pinpoint what can be causing that issue. Except maybe the investigation when they do for your mother was not the right investigation, then you will need to seek more medical experts so that to treat your mother. And as for that woman, I think it would be nice you see a medical expert, so that they can do other investigation for her. A teaching hospital will not be bad for that your mother to go, because you never can tell what is really causing that.
Okay, let's see if we get questions here. Edo Precious, good evening. I try register on your Telegram. I don't know what I'm doing right. Edo Precious, please, what do you mean? Explain. Let's see. We have more questions here. Okay, see these comments here. Doctor, can prolonged use of hydrocortisone cream affect a baby? I'm a nursing mother and I'm using it to treat dermatitis.
Okay, the first question is, who gave you the cream to treat dermatitis? So I don't think hydrocortisone cream is the best treatment for dermatitis. So whoever gave you the cream, I think you should see a dermatologist, that will help you to give you the right cream or the right treatment for that dermatitis. And also, using hydrocortisone cream for your child for a very long time is bad. It's actually bad. It's bad to the health of that your child, and it's bad to the health in many aspects. even to the immune system. It can affect the immune system to the extent say the immune system will not be able to fight other infection. Dr. Fred, am I still with you?
Okay, you're back.
Okay. So it fights the immune system to the extent say the immune system no fit fight other infection. Yes, you fit dey see your skin say your skin, the skin con dey fresh or e con dey fine, but it is also damaging all the normal flora wey dey that skin, because e dey weaken the work wey dem suppose fit do. So the best thing, see a dermatologist so that e go give you the best treatment for the dermatitis, if actually it's dermatitis that you really have or the child has. So I think that's the best thing I go fit talk
Okay,
concerning that case.
okay, okay. So she has responded. Before we go to the next question, because of time, she says it was prescribed for you, which we go advise you to say take how them say me you take and then stop. If they say make you use them for 5 days, I beg, no use them continuously. Make you go, they use them, they go. Do you understand? If doctors say may you take them for 1 week, please just use them for that time where they say may you use them and then stop. Philo, I hope it's clear. Yeah. Okay, we have a question here. I beg, hope
Also,
you people are
also,
sharing. Yeah.
sorry, Dr. Fred, sorry.
Yes. Go ahead.
Also, if you don't use them for the days when your doctor prescribe and nothing is happening, and your doctor not be dermatologist, abeg go see dermatologist. Yeah.
Yeah. Yeah. Okay. Yeah. Thank you. Now, before I continue, there is something I see. These people know they share this live session. I don't understand. You know they share the live session. So I really don't get it. You want me we can't talk about Nyash on the internet before you go support us? No, no, let's talk now for 1 minute. I just check now. People will share this live session. They very, very few, but you are asking us questions like back to back, but you know they share. So what did they happen? Tell me, I beg, what's going on? Okay. Now somebody's asking a question here. It says, I heard fluoride is harmful, and almost all toothpaste we use has it in it. Please, can you enlighten me more? Thank you. Thank you. Okay, let me respond quickly. You heard. Where did you hear? That is number one. Number two, fluoride is very beneficial. Oxygen, where you they breathe. If you take oxygen past a certain amount, oxygen when you they breathe, they harmful to you. Are you aware that even the oxygen, it get how they will give you highly concentrated oxygen, it will give you problem. Does that make oxygen bad? Because I know where you're coming from. I have seen some people where they talk about all these things. In the right amount, fluoride they help your teeth prevent dental and cavities. People they use fluoride in certain amounts to do their metal and other things. So in the right amount, fluoride they help your teeth, they protect your teeth. If you go take them beyond the amount, that is why they measure and put for toothpaste. If you go take them beyond a certain amount, it can still damage the teeth for you. So don't allow anybody come and tell you this thing is bad. So should I come and tell you now that oxygen is bad? Everybody will stop that they breathe oxygen. Oh, no, oxygen is very good for the body. But you get certain conditions, we say you gotta go pump oxygen into your system, it will even give you more problem. So this is why we have to strike a balance and understand where whoever they talk, where the person they come from, not creating panic and make people they fear. Blessing. Is that okay? Okay, do you have anything to add? Okay. Somebody says, I can't find you on Telegram. You can't find me. You won't see me on Telegram unless you subscribe through the link on my page. Now, only when you subscribe, you go fit enter my Telegram. You can't just go to Telegram, find me, and join. It doesn't work like that. The only time you can join my Telegram, my private Telegram, now when you subscribe. If you don't subscribe, sorry, you can't join. Yep. Okay. Please, can family planning cause smelling menstruation and discharge. Ah, Dr. Israel, you want to respond? Dr. Israel, network don't hook. Okay. Now, family planning no dey cause smelling menstruation and discharge. No, e no dey cause am. Wetin dey happen to you na something else wey no dey related to your family planning. Because many women don use family planning, and the family planning wey dey use, some of them dey get some kind side effects. Some fit get they fit dey add weight. Some their period fit disappear. Some their period fit dey long. Some fit dey get small small pimples, acne. But say your menses dey smell, no period. Family planning no dey cause am. Now we get different types. Listen, different types of family planning, different types. And depending on the type of family planning wey dem put for you, na im determine the kind of symptoms wey you fit get. Some women, if dem insert, e get the one wey dem dey insert inside their body from under. If dem no insert am well, or the woman get problem around that area, e fit make the woman get some issues, maybe infection. You understand? So you need to be careful and find out wetin dey go on. Na this family planning wey dem put for my body. If na the family planning, you go know. They go tell you, okay, take this medicine. That is why whenever you want put family planning, we dey always advise, may you go family planning clinic where doctors and nurses and senior nurses dey, wey go guide you and help you on all the things to know about family planning. Is it clear? Okay. Oh yeah, share. Glory. Oh yeah, share now. If you share, talk say I don't share. Una no dey hey God abeg o. Una no dey share o. Una no dey send stars o. You know abi. I can't sleep well. Is it good to take sleeping tablets to sleep well? Okay, Dr. Israel is back. Dr. Israel, welcome back. Alpha, can you hear me?
Yeah, I can hear you.
Okay, somebody says, I can't sleep well. Is it good to take sleeping tablets? Abeg, wetin you go advise am?
Okay, the question is, when you say you cannot sleep well, how many hours you dey sleep? Because some people, when they say they no dey sleep well, when you help them calculate the hours when they dey sleep, you go surprise say they don complete almost 6 to 7 hours of sleep already, and still they will still say they no dey sleep well. And two, another thing is, when you say you no sleep well, what time do you go to bed? Because some people, when you go to bed very early and you start calculating that time till when you can't sleep, you may be thinking that you are not sleeping well. And that's two. And three, when you lie down for bed, wetin you dey do? You dey press phone. If you dey press phone, e fit make you no quick sleep, and that will actually cause you're not sleeping well. So try sort out those issues first, and then we go know whether you no dey sleep well. But yeah, if your doctor prescribe you to take any sleeping medicine for some time, no be say na something wey you dey take all the time, so that you no come go depend on am. If your doctor prescribe am for you, say, okay, take this medicine for this time, you are free, take it, and it will be fine. It's not bad. But if your doctor not prescribe am, e no go make sense say you go buy am by yourself. Normally sef, those drugs no be wetin dem dey go, those medication no be wetin dem dey go buy for any pharmacy. You must get doctor prescription to take get those medication. Except maybe some of our chemists here now and pharmacy. Well, might not talk past that one. But you need to have a doctor prescription to get all those medication.
You don't hear o. Thank you so much, Dr. Israel. We get about 15 minutes more and then we go end the live session. Please, doctor, I want to know what causes or make placenta not to function well, because my friend put to bed and the child is so small. She's the best. You want to know what makes placenta not to function well? Because your friend put to bed and the child is so small. So, Cheesy, make I ask you one question. Who told you that the reason why the child is so small is because of the placenta? That the placenta was not functioning well? How did you arrive at that conclusion that the reason why this woman gave birth to a small baby was because of the placenta? Eh, that's my own question to you because I want to know. Because there are many things that can make a woman give birth to a pikin, and the pikin no go big when she give birth. If it be the mother problem, the woman gets sickness, maybe. If it be the pikin itself, maybe. If it be genetic from the gene of the papa and the mama, small pikin, or placental problems. So there are many things that can happen, or maybe get wetin the mama do or take. So you can't just conclude and say the reason why this baby is small is because of the placenta. So throw more light and answer this question for me. Dr. Israel, want to add anything to this?
No, 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 no.
Okay. We have a question from Latifat. It says, please, what causes heavy vaginal discharge, but whitish and not sticky? Because I have PID and I'm on treatment. You have a heavy vaginal discharge
Okay,
that
you
is white.
say you,
Go ahead, go ahead.
okay. Based on all what you do, well, all these few symptoms or one symptoms that you mentioned, and you try to describe how the thing be, you try, and you also end up by saying you already there on treatment for PID. I believe saying now doctor now give you that medication to take the treatment. So if you never finish the treatment, you need to try finish am, because if you finish am, those discharge may stop if it's something that is if na infection actually na dey cause those, or if they give you the right medication. Let me use that word. If they give you the right
Mm-hmm.
medication. So if it's not smelling, it's many, it's not sticky, but if e dey draw, that one fit be another form of normal discharge when woman dey see, but you never can tell. So but you say you're the treater, so finish your treatment and you know if actually there was a problem or there was no problem.
Thank you, Dr. Israel. Now, please, I beg, for people who just they enter the live session now, we started 8 p.m. on the dot. This is 8:48 p.m. People don't day here before you. So you can't just enter the live session and start asking questions and want us to respond to you immediately and make we ignore the other people we don't day here before you. So if you come late, you will wait, pray to God, may we get to your question. If we miss your question, send them again. Send them again. Rephrase them. Maybe we go see them. But nobody say you go just enter this session now. You dey ask question and you can't verse for us. So we send your questions, and then we hope and pray that we can see it and respond to you. Don't forget to also share the live session. Okay, now we have a question here. It says, "Oh my God, can one be pregnant again after treatment of PID?" The answer is yes. If you treat them, yeah, sure, you can get pregnant. Nobody talks if you get PID, you can't get pregnant. Sure, you can get pregnant. Yeah, yeah. Okay, we have a question here, Dr. Israel. It says, I'm scratching all over my body, especially my laps, my waist, whenever I remove my belt. So, whenever you take off your belt, you scratch your lap and your waist. Please, I beg, help me respond.
Okay, most of the time when you be say you really know wetin dey cause those itching, so some of them can just be allergic reaction. So if na
Mm.
allergic reaction, you need to look for a way to stop those allergies. All those things when they cause the allergy can be that you are reacting to the belt or the particular cloth when you wear. And if na tight cloth, then when you pull out you dey inch, you notice na because e tight. So you need to dey wear cloth wey not too tight. And you know say you use belt, e mean say when you use the belt you tight am well well. So all those things fit be the cause of that inching, and sometimes death can also be the cause. So as far you fit even know say now anytime you tie belt and you lose and you dey get those itching, it can just be an allergic reaction. um if na allergic reaction, you meet your doctor, you know what medication wey go give you, and the thing go stop. Also you can actually change that belt or
Mm-hmm.
change those cloth wey you dey wear, because those one are the main treatment. If na allergic reaction, those are the main treatment for you.
Okay, thank you, Dr. Israel. Please, people, share, invite your friends, invite your friends. If you want to sponsor this live session, if you want to put adverts, yes, you have adverts, you have brand, you have something, a business you want to promote, send me an email. Let's talk. You want to sponsor the program or you want to promote something, you want to do an advert? Yes, we don't get to that level where we talk am now. So send to this email on your screen, and we do business. Okay, Dr. Israel. We have a comment here. He says, let me see. Okay. He says the doctor explained to us that the placenta was not functioning well. So I want to know the actual cause of it, why the placenta was not functioning well during pregnancy.
Okay, I don't think I'll be the best person to give you the answer to that. Because as we said, there are so many things that may make the placenta not to function well. So one of it can be infection. One of it can even be the formation of the placenta and all that.
Mm-hmm.
So, and yeah, the formation of the placenta, even infection and all that, and even the maternal nutrition. I tell they eat when they supply the placenta, when they supply the baby. So all those are some things, and there are some things we call placenta abrosio and all that. When we say the placenta not really stick to where it's supposed to stay for the mama body. So all those ones we see cause wetin go make the baby not grow well, because the blood wey suppose dey pass through there to the placenta not dey even enter well, and that can even cause death of the child. Another thing, if the baby wey dey talk say e small, if e size not too small pass where im mama be, e no be problem to me o, no be problem. um and also if the baby actually complete the number of months wey e suppose complete, and there was no problem to rush to bring out the child, I don't think the placenta actually have an issue on that. However, if you really want to find out, if you have a gynecologist, an obstetrician, you can ask the obstetrician. He will give you all the reasons why baby can be small due to placenta cause. But the ones when I fit remember, or the one when I fit tell you now, I tell you today. Eh? Thank you.
Thank you. Our time is almost up because this program now 1 hour. Okay, we get a few more minutes. Doctor, please, I want to know if a woman can menstruate twice in a month.
Yeah, the answer it depends on the person's cycle. If the person's cycle
Yeah.
is less than 30 days, maybe 28 days, 25 days, the person is likely going to menstruate twice in a month, and depends on when he saw the first menses. So the person is likely going to menstruate twice in a month. So it's not really a bad thing. However, if the first menses to the second menses is very short, like 2 weeks, that's like 14 days now, um then it can be a problem. So when you dey notice, if na just once you notice am, we may not want to be worried. But if you notice am, you come dey notice am like that, you will need to quickly
Mm.
see a medical a gynecologist, because there might just be a problem. Hormonal problem may just be the cause, so that they can address it, and then you'll be seeing your menstruation at the right time.
Okay, you've heard. Our time is almost up on this live session. In case you came late, no vex. Now 8 p.m. we dey start. Okay. Let's see. This one says, please, what causes taste malformation in children? Taste. I don't understand your question. I don't understand your question. This one says you don't want to answer me. We don't answer you. Taste. Dr. Israel, do you understand what you mean by taste malformation? Is it taste or tastes? I don't get that. I don't get it. I don't know what you're talking about.
Yeah, I don't get it because I don't think a child can even tell you how their taste is. So I will not be able to answer that.
Okay, we are almost out of time. How many more minutes we get? 5 more minutes. Please, if PID has not gotten to tubal blockage, can it also delay conception? Oh my God. So Israel, beg respond.
Okay, so PID is a different PID, pelvic inflammatory disease. It's not just a single disease. Eh? It's like a combination of so many things that can affect the woman reproductive system. Eh? Now they lead to PID. So you can have infection and in different parts of the human reproductive system. Then you can call and say na PID. And now when the PID don't do the body for a long time, that's chronic PID. Before you feel they think about maybe you go affect the fertility of the woman. So if you never get infection, we can lead to tuber blockage. It never lead to tuber blockage. You can still get pregnant. You can still get pregnant. Just follow the right procedure. Meet your gynecologist. You go do some investigation for you. You go do some other things for you and follow the right pattern, and you get pregnant. Know your menstrual cycle, know your ovulation day, know all those things. And so when you know all of them, you will likely become pregnant. And so not to stress yourself for PID, because most ladies, sometimes most of them get PID and they born 5 children self and they're already nothing do them. So you follow the process and you get pregnant.
We don't. I don't tire. I don't tire. Doctor, please. Someone go do urinalysis test, and everything is negative, and still having frequent urination, while it not having sugar. What may be the problem? Mm.
It just simply shows say this person will go do urinalysis test. He just enter lab, go tell them say na urinalysis test he want do. Now this
Yeah.
question show, because you doing
Yeah.
urinalysis test is not equivalent to frequent urination. Eh? Urinalysis test may not show you anything reasonable or anything significant. So I think this person should go back to the hospital. You should go to the hospital, go and see your doctor. So you have to do other investigation to be able to show what is actually causing the frequent urination. In the other hand, if you be person when they drink a lot of water, you don't need to be afraid. You just show say now you were drinking too many water, now they make you they urinate often and often. So you don't need to dey fear. But if not be that, it simply means say you see your doctor, and your doctor go do some other investigation, not be urinalysis again this time. Go do some other investigation for you and ask you some other questions. Because all those questions go still determine the kind of investigation wey e go send you make you go do. So that's that.
Yeah. Thank you so much, Dr. Israel. Time don't finish. Last one. Normally it dey work for the other room, but the morning erection no dey happen. I thought naturally the morning erection dey necessary. Dr. Israel don't answer you now. Not every man will get morning erection, depending on a lot of factors. Maybe you dey very stressed, maybe your age, and other things wey you dey do. But if you be young man, young men they get them, but as they increase for age, you know go dey like that. But that doesn't mean you have a problem, especially if you dey work steady for the other room. But if you notice, say they get the money, they stand, they work for the other room, then you need to see your doctor because of time. Is it advisable to go for HSG test? Because I heard it's painful. Please, is there any complication after the test? You don't go for HSG test if your doctor no send you. You don't have to be taking yourself for any test. You don't just wake up and go and do HSG test by yourself. You go waste your money. You go suffer yourself. You could just go do tests where you don't need. But this is why you should always discuss with your doctor so that your doctor will guide you and ensure say you did the right test. So, Israel, any final words? We are out of time.
Okay, for my final word is to remind us say today now World Hepatitis B Day. And funny enough, today I was in a place where they do one outreach and somebody said something. And they try to tell her the results, all the results when you get. I say hepatitis B is negative, hepatitis C is negative, HIV is negative. Before I say HIV is negative, we can't say, beg, I know say I not get all this one. I say because my parents not get them, not be hereditary. So I knew that this guy really not know how they get them. So I have to tell her, so these are the ways you can get hepatitis B and C. And he was shocked. Oh. So when I tell him finish, I think he has learned one or two things. So hepatitis not be it not be from mother not be hereditary. So say your parents get hepatitis, it's not a must that you will have it because it's not hereditary. And because of that, it's for us to know our status. Know your status, know your HIV status, know your hepatitis B status. If you know your status, there are preventive measures. For hepatitis, there's vaccine. Go and take your vaccine so that you will be protected. Hepatitis B, so you will be protected. Then for HIV, there are preventive medication that you can use, and you will also be protected. So I use this medium to remind us, say hepatitis B or C is real. So test yourself, know your status, and stay healthy. Thank you.
You heard Dr. Israel, test yourself, know your status, stay healthy, protect yourself. Thank you so much, Dr. Israel. Thank you, everybody, for joining us tonight. Thank you for spending your data on this page. This program now 8 p.m. Nigerian time to 9 p.m. 1 hour every Sunday. If you miss, I beg, no miss next week. We don't do and they come since it no be today we start. You don't say. So next week Sunday we go get a topic. Thank you. And if we no answer your questions, no vex. Say we know if we answer your question because of time. We hope by the grace of God, some other time we go fi answer you. If you want to join my private Telegram, look for the link on this live session. Look up, you go see one link for there. Click on the link, subscribe, and join. And I'll be waiting to have you there. I can always tell you, good life now waiting. Good life. In that sense. Take care and have a wonderful evening. Bye bye.
Bye.